Here's how hormone imbalances affect the way you look. We're talking about high testosterone today. As women, we need testosterone. It's important for things like our libido, our skin health, our muscle tone, but when it becomes too high, that's when we see an issue. In general, testosterone makes the skin thicker and oilier. That means more acne. It can also cause little hair growths on our upper lip, our chin, our nipples, and other places that we wouldn't really desire hair to be. And to make matters worse, it can also cause hair loss, especially in the front of the head and the crown of the head, known as like female pattern balding. So when it comes to fixing high testosterone levels, the first question we have to ask is, why is testosterone high in the first place? There's typically two reasons outside of things like tumors or genetic issues like adrenal hyperplasia. Now, what we need to be looking at is insulin, because high insulin tells the ovaries to make more testosterone. We see this commonly in conditions like PCOS. In fact, some people refer to PCOS as diabetes of the ovary. So the cornerstone of fixing high testosterone levels is rooted in nutrition and balancing insulin levels. So what that means is we need to have 3 meals a day, no snacking in between, and making sure that we have adequate protein, 30 grams 3 times a day. We also want to focus on whole foods, none of the ultra-processed foods, and focus on having things like nuts and seeds and fatty fish, all that have the omega-3 fatty acids in them. Another important component is fiber, so making sure you're having, again, lots of vegetables, nuts and seeds, legumes, and beans. When it comes to herbal and supplement approaches, 3 of my favorites are right here. The first one being myo-inositol, which helps the ovaries to ovulate, which is great in PCOS, and it also helps to decrease testosterone and all the effects that come with it. Next is alpha-lipoic acid, great at sensitizing you to insulin and therefore helping with testosterone. And most importantly is berberine. So this is kind of what I would opt for the insulin side of things. The combination of licorice and peony is another go-to for not only PCOS, but high testosterone specifically. This combo is going to help you to ovulate, help with all sorts of PMS symptoms, and licorice and peony help to lower high levels of testosterone and the effects that it has on your skin. Plus, licorice is a powerful adaptogen, so if you're burnt out and tired and worn down, this is going to help a lot too. Also, zinc is going to be your best friend here. Zinc is pretty cool as a mineral because it'll help to increase your testosterone levels if they're low, but it helps to lower them if they're high, and it's very anti-inflammatory on the skin. So some studies have shown that taking zinc is as effective as taking an antibiotic for things like acne. Now, the other reason why your testosterone can be high is more so rooted in stress, because when we're stressed, it tells our adrenals to make cortisol and DHEA. And DHEA is a precursor to testosterone. So testosterone and DHEA are both high, both have the effect of making your skin more oily, more acne prone, and result in hair loss too. Stress reduction is key here. So looking at your life, what can I take off of my plate? Am I getting enough sleep? Am I getting 8 hours a night? Am I eating enough? Am I eating 3 meals a day? All of that still applies. In terms of herbal support, I'm a huge fan of ashwagandha. You might say, doesn't this increase testosterone? No, it's one of those things like zinc where it can help support testosterone if it's low, but it can help lower it and balance it if DHEA and testosterone are high, so don't worry. Other adaptogenic herbs that I like are magnolia bark and jujube, especially if you have restless sleep and a hard time falling asleep. These are really going to help you get a sound sleep, which helps to lower your cortisol and DHEA and help with testosterone.